Cystic fibrosis is an autosomal recessive disease caused by mutation in the CFTR gene. It is systemic, affecting various organs and systems. Hallmark symptoms include respiratory distress, chronic fatigue, and recurrent pulmonary infection. Both parents need to be carriers in order for a child to inherit this disease. To be classified as a carrier, you must have one copy of the faulty CFTR gene. If two carriers were to conceive a child, there would be a 1 in 4 chance of them being born with CF, alternatively, further carrying the gene. The CFTR gene codes for the CFTR channel. This acts as a door, controlling the movement of chloride across the cell membrane of secretory organs. In CF, these channels are dysfunctional. If the chloride does not get across, then neither can water, and without water, we end up with a build-up of sticky mucus in our internal organs, most prominent in the lungs. Now let's look at some statistics surrounding CF. In 2016, approximately 3,422 Australians were living with CF, and around about 70,000 people worldwide. That is 1 in every 2,500 babies, and 1 in 25 people carrying the gene. The estimated life expectancy is 40 years. This is increasing as treatments continue to improve. The graph here represents the distribution of CF across Australia by sex and age, showing a higher prevalence of the disease in men than women. Multiple organs of the body are affected by CF, including the lungs, the liver, the pancreas, and reproductive organs. The main system affected is the respiratory system. Thick mucus trapped in the lungs creates a perfect breeding site for bacteria, initiating an inflammatory response. This can in turn lead to secondary responses such as pneumonia. CF also affects the gastrointestinal system. Mucosal buildup in the pancreas forms blockages of the pancreatic ducts, preventing enzyme secretion. These enzymes are critical to absorption of nutrients and proteins, but a lack of them can lead to malnourishment. Not only this, but it can also cause a decrease in insulin production, resulting in CF-related diabetes. As for the reproductive system, in men, the vas deferens is either malformed or not present. Sperm production is not affected, but there are risks of infertility. In women, infertility is less of an issue, but thickening of the cervical mucus can slow sperm movement during fertilization, making it harder to conceive. The chloride test is most common for diagnosing CF and measures the levels of sodium chloride present in sweat. CF patients have higher chloride levels than those without. Other detection methods include prenatal screening, newborn screening, and DNA analysis. Cystic fibrosis has no cure. Symptoms can only be eased. Airway clearance is a method used by wearing a vibrating vest that loosens the mucus in the lungs, enabling it to be expelled. Doctors also prescribe medications like antibiotics, enzyme capsules, and mucus thinners. CFTR gene therapy is another option, whereby the dysfunctional protein is corrected. Unfortunately, only certain people with specific mutations can undergo this treatment. And, as a last resort, lung or organ transplants may be required. The future of CF looks bright, with tons of vital research constantly being conducted. Even here at the University of Adelaide, there has been a breakthrough involving stem cell transplants and gene therapy in mice. If you would like to learn more, support, or donate, please visit the CF Australia website.